When it gets this cold, obviously it can be very annoying, but also very painful. So we have Dr. Brian Braxton here. He is the medical director with the ER at Parkwest. He's here to answer some questions for us. Good morning.
Good morning, Al.
We brought you in because obviously this can be pretty dangerous if you're outside for too long. What are some of the injuries or incidents you see with people in the ER this time of year?
Well, obviously hypothermia is very common. It's very easy to get frostbite in this kind of condition, especially the elderly, children, homeless people often come in having suffered the effects of frostbite. Slips and falls, obviously, as well, on the ice, very common. Sometimes carbon monoxide exposure from heaters, things of that nature. Sometimes people using their stove inappropriately to warm themselves can cause fires and things.
And for people who've been outside exposed and they think they have maybe a skin issue, a hypothermia or a frostbite, how quickly do they need to get in?
In this kind of weather, you can suffer the effects of frostbite in 5 minutes of exposure. Areas of the body like the ears, nose, toes, exposed areas are very prone to frostbite very quickly. So it's important to, when you start to feel the numbness, tingling, burning sensation, it's time to come in.
Okay, so even though the kids don't want to wear the gloves and scarves and all, very important.
Absolutely.
All right, and any last safety tips for people this time of year to try and avoid an ER visit?
Well, I would say if you go out and there's ice, be very careful. Try not to walk with heavy packages. Walk like a penguin, flat feet. And I think just being mindful of hypothermia when you start to feel the effects of frost snip, get inside.
All right, thanks.